Hello and good day to our dear lecturers. We are from Group 12 and today we have prepared this beautiful and carefully made presentation to share with you about the right technique used in the phlebotomy. Our presentation is comprised of three parts, which are first, the introduction, second, the procedure for drawing blood, and lastly, the conclusion. Now, we are going to begin with the first part, which is the introduction. The process of collecting or drawing blood from a vein is called venipuncture. Venipuncture is the most common way to collect blood specimens for laboratory testing. It is also the most frequent procedure performed by a phlebotomist. The most crucial part in the venipuncture procedure is the patient identification. Moving on, let us dive into the second part of the presentation, which is the procedure of drawing the blood itself. Before we start to collect a blood sample, we have to gather and arrange all the materials. Typically, a syringe with appropriate size, 21 or 22 gauge safety needle, vacuum tube for test audit, 70% isopropyl alcohol, gauze pads, tourniquet, and disposable gloves are needed during the procedure. Next, identify the patient and double-check their requisition order against the paperwork to ensure the proper tests and samples are required. After confirming with the patient, put on the disposable gloves and pull and depress the plunger several times to loosen it in the barrel while keeping the cover on the needle. It is important to note that the plunger must be pushed in completely after it has been loosened. The first step is to locate the vein. This is done by applying the tourniquet around the patient's arm 3 to 4 inches above the elbow. To be noticed, the tourniquet should never be tied so tightly and can only remain in place for 1 minute. Then, select the venipuncture site by palpating the antecubital space. If no veins are palpable, ask the patient to form a fist and squeeze. Next, locate an appropriate vein for venipuncture. Disinfect the venipuncture site and the surrounding area with 70% isopropyl alcohol pad. Begin in the center of the area and work outward in a circular pattern or rotation. Do not touch the puncture site again. However, if you really must touch it again to feel the vein, touch your fingertip to a sterile alcohol pad first. To anchor the vein, grasp the patient's arm firmly by gently stretch the skin downward. Make sure the bevel of the needle is pointing up. Anchor the vein with the thumb of your opposite hand about 1 inch below the puncture site. Next, grasp the patient's arm firmly using your thumb to draw the skin taut and anchor the vein. The needle should form a 15 to 30 degree angle within the surface of the arm. Swiftly insert the needle through the skin and into the lumen of the vein. During this stage, it is important to ensure that trauma and excessive probing does not occur on the patient. The tourniquet must be released from the patient before withdrawing the needle. However, some guidelines suggest removing the tourniquet as soon as blood flow is established and always before it has been in place for 2 minutes or more. Withdraw the needle in swift, smooth motion and immediately apply gentle pressure to the venipuncture site with a clean gauze or dry cotton wool ball. Ask the patient to hold the gauze or cotton wool in place with the arm extended and raised. Also, ask the patient not to bend the arm because doing so causes a hematoma. When obtaining multiple tubes of blood, use a vacuum tubes with a needle and tube holder. This system allows the tubes to be filled directly. Pierce the stopper on the tube with the needle directly above the tube using slow, steady pressure. Do not press the syringe plunger because additional pressure increases the risk of hemolysis. Needle safety features are an integral part of the device and not an accessory. They are one of the most important venipuncture components. The safety features must provide immediate permanent containment of the needle and the ability to initiate it with a single hand which must always stay behind the needle. The most common safety feature are resheathing devices using one scoop technique. These are shields that cover the needle or retract the needle after use. Never recap a needle using both hands. After we engage the safety device to the needle, discard the used needle and syringe or blood sampling device into a puncture-resistant sharps container. The needles are never recapped, removed, broken, or banned after phlebotomy procedure. Label the tubes in the presence of patient in the drawing area and only after the blood have been drawn. It is important because the risk of receiving unsuitable samples can hence be enormously reduced when precise instructions about the type of container and its immediate management are reported in pre-labeled blood tubes. Check the label and forms for accuracy. The label should be clearly written with the information required by the laboratory, which is typically the patient's first and last names, file number, date of birth, and the date and time when the blood was taken. Before leaving the area after finishing all the phlebotomy procedure, make sure to recheck the venipuncture site to ensure there is no blood flow out from the venipuncture site. Also, recheck the labels on the tubes and the forms before dispatching them. Inform the patient when the procedure is over. Ask the patient or donor how they are feeling. Check the insertion site to verify that it is not bleeding. Then, thank the patient and say something to reassure and encourage them before they leave. Lastly, discard used items into the appropriate category of waste. Items used for phlebotomy that would not release a drop of blood if squeezed, such as gloves, may be discarded in the general waste. Perform hand hygiene again as described above. Now, we have come to the last part of the presentation, which is the conclusion. To summarize our presentation, standard operating procedures must be followed when it comes to infection control and quality assurance. These steps should be made available to phlebotomists in a clinical environment. To effectively control and prevent infections, proper hygiene materials must be used. The list of hygienic materials to be kept in a medical environment conducting phlebotomy includes soap, water, alcohol rub, non-sterile gloves, single-use disposable needles, syringes, or lancing devices. In the same sense, contaminated phlebotomy equipment must be discarded in an appropriate manner. Did you know that up to 25% of tourniquets are contaminated through inadequate hand hygiene? Also, hepatitis B has been known to spread through reusing finger prick devices. Needles, syringes, and blood sampling devices should be disposed into a puncture-resistant sharps container in order to uphold proper phlebotomy safety standards. It is also important to know which pieces of equipment can be reused versus what should be discarded. And that is all from us. We would like to give our utmost gratitude to our dearest phlebotomy lecturers for providing us with knowledge on this subject for this semester. Thank you for all of the good and kind efforts you put into teaching us. We really appreciate it.